AHF holds Miami Beach rally against Gilead and drug culture of HIV.
Gilead Green has got to go, hey, hey! Ho, ho! Gilead Green has got to go, hey, hey! Ho, ho! Gilead Green has got to go, hey, hey! Ho, ho!
On March 7th, Gilead Sciences announced the company would be webcasting its corporate presentation at two of the investor conferences, the ROTH Growth Stock Conference in Dana Point, California, and the Barclays Global Healthcare Conference in Miami. Kevin Young, Gilead's Executive Vice President, Commercial Operations, provided an overview of the company at the Barclays Conference on Tuesday. AHF has been fighting against Gilead for the past year, dubbing the massive pharmaceutical company Greediad, after the company limited what medications are covered by the 340B pricing restrictions and offers special discounts to providers who use Gilead-contracted pharmacies. AHF President Michael Weinstein said, quote, Gilead's greed has also reached a new level, intentionally wrecking the HIV healthcare safety net, slashing its patient assistance programs. Harvoni, one of the HIV drugs now subject to Gilead's illegal 340B restrictions, is priced at $1,000 per pill for people without insurance, which is just madness, end quote. AHF has been hosting continual protests against Gilead since early in 2022, appearing at conferences in major cities around the world. Yesterday, representatives and volunteers from AHF appeared at the Barclays conference with signs reading, quote, "Stop being greedy," and Greediad. You know, this is a fight that AHF has had against Gilead for a long time. The 340B program, what it has allowed us, this is a program that we fought for from way back in the 80s when everybody was not, we had no money. Reagan, the government wouldn't give us not even $1 for research. Mm-hmm. And so in that battle, we were able to come up with federal programs to help pay for people's medication because the medication is too expensive for everybody, right? The 340B program allows like an AHF to even be open because we can buy the medication from like a Gilead at a discount rate, but sell it at the retail rate. And so that price difference becomes the money you use to pay for your staff, pay for your office, buy gloves, buy syringes, right? It keeps the lights on. And so it's very, very important, this program. Most HIV care in America would stop if there was no 340B program, right? Because nobody can afford that price difference.
So what is Gilead doing that people are unhappy about?
Well, what they've decided is a medication like Harvoni, they said, well, you know, it comes down to patents and things like this. And so they've decided that that medication, they're not going to put in 340B. So if you want it from Gilead, you have to pay full price. So then you sell it at full price, so you make zero. So it's a really expensive medication. The thing is, when you work in healthcare, you want the patient to get the best, right? So if that's the best medication for you, then you have to think, okay, I'm giving this patient this medication, but like literally we're making no money. Like if we gave every medication and made no money, we'd have to close. Right? It's very, very dangerous. They've played these games before, Gilead, with PrEP. What they were talking about, stopping their patient assistance programs. They just decided that people without insurance, I don't know how you're going to get PrEP. We used to be able to use 340B and other patient assistance programs to give PrEP for free. We can't do that anymore. They looked around at their numbers and they went, we're giving away a lot of medication, not realizing, you know, that's the least they could do. They make a ton of money off of our lives.
So how does it still work? Because I see, I'm sorry, I want to just real quick.
Yeah.
I see like Midland and many other organizations, you know, register for PrEP. It's free even if you don't have insurance.
Right.
So how are those programs still continuing? Because I was under the impression that all is well.
Yeah.
Because I have insurance, because I see all these things at prides and things like that. So how is the world of pharmaceuticals and treatment still spinning?
Well, people have gotten creative with finding other programs and underfunding sources, but it means now that staff member has to take all day to find 10 different programs to cover the price of your medication instead of Gilead just writing it off, which was so simple. And one reason why so many people got on PrEP was their patient assistance program was so smooth and it was easy. And if you came in and you were negative, I could make sure you had that medication in your hand before you left, right? We want to keep you negative. And now we can't do that. Now we sometimes have to tell people, you got to come back next week. We have to make 100 different phone calls and figure out who's going to pay for this.
So the way some of these organizations would...
It's really bad.
Yeah.
Because they make so much money off of us. What they were giving back is a small percentage of what they make, They could afford the patient assistance program.
And the way some of these patient assistance programs would help these clinics that are doing that as well is the discounted rate for the drug. That money is much easier to find in community resources, grants and stuff than the full price. So frequently, if Gilead was offering them a discount where it was, $100 a pill for Descovy instead of $1,000, it's much easier to get that covered by government grants, government programs beyond the 340B. That way, Gilead still gets some money. You can still help people in need. The way some of these organizations are working around it now is by helping people get enrolled in healthcare at low cost through the healthcare marketplace, and then using the different programs to help cover the costs if you have low income. Yeah. Like that's how Midland does it for a lot of their patients. They will help you get insured through Florida Blue, through the healthcare marketplace, and then use the other grants and stuff out there to help supplement the cost of the insurance based on your income, which still helps people get the PrEP that they can't afford and additional health care.
And then, in the bigger picture, you have to remember the goal is no more HIV, right? Mm-hmm. Like, we want no more HIV transmission. We can't do that without access to PrEP. It's impossible. We have to have people on this medication and unable to contract HIV if we're ever going to win the battle against HIV. And so they're making that so much more difficult around the world. Remember, we're talking about here where people are very knowledgeable and there's lots of services. The rest of America is not like that. Mm-hmm. The rest of Florida is not like that. You could barely get PrEP on the West Coast. It's very difficult over there because there's a lot of homophobia over there. They don't want to talk about PrEP or sex or people with HIV or anything. And so when you get out into the real world outside of our little bubble here, it becomes very, very difficult. And then the battle against HIV itself is going to be impossible to beat,
And another example of what AHF is mad about is Gilead produces the COVID medication Paxlovid. And while here in the US, the government worked out a deal, so you can get it at a very reduced rate. Anyone can. It's super cheap. Insurance will cover it. You can get it very inexpensively. Other parts of the world, they're charging full rate, which is an exorbitant amount of money. I don't know the exact pricing, but it's far out of the budget of most normal people. So people in other countries are still having higher than normal fatality rates from COVID, because this simple, easy treatment isn't available to them that we have here in the U.S. I can get Paxlovid at CVS.
Yeah. Yeah.
I guess there's a reason that people come before profits in the dictionary. I wish it was that way in real life.
Astute observations.
Yeah, just a little bit.
I mean, we're trying.
LGBTQ plus news is vital for our community and for the broader world as a whole. We have enough enemies at Fox News. Tucker, Sean, and Laura are loud. We need passionate allies. Happening Out Television Network, Queer News Tonight, and It's Happening Out are literally out of the closet and into the headlines. Our community needs your support. Like this broadcast and subscribe now to ensure the growth of the entire LGBTQ plus community.